Why do we need pap smears?
Guidelines recommend to check pap smears on a healthy person who is in a monogamous relationship to use pap smears every 2 to 3 years. But the reality is that most of us in the age of between 20 and 30, we're not in a monogamous relationship, and that's why pap smear is recommended every year.
What can an adult do if the pap smear comes back abnormally?
What does it mean? It could mean anything. It could mean just because you have any kind of inflammation in your body can create inflammation on the cervical cell surface and create certain look on the cells that pathologists could read as abnormal, as atypical. Atypical cells usually is one step away from normal type of changes on cervical surface. They could be caused by either HPV, which is a virus, and they could be caused also by any kind of other possible triggers. It could be menstruation, it could be use of tampons, it could be recent sex, it could be use of birth control pills. Sometimes can increase the size of the cells, not necessarily create inflammation, but create that looking abnormal. So according to certain changes on the pap smear, certain steps should be taken.
What are the scenarios that may take place in result of the pap smear?
So the results of the pap smear could be in looking differently, depends on what kind of cells pathologists will see. One perfect scenario for the pap smear is when pathologist looks under the microscope and sees absolutely healthy, absolutely beautiful looking cells. That is one good scenario. That's when we say your pap smear came back normal.
What are the symptoms of HPV?
If your pap smear is abnormal and your doctor is saying that your pap smear is abnormal due to HPV effect, first question will arise, how far that degree of abnormality you went to. You need to know certain severity of the changes of the pap smear cells, cervical cells. You need to know how cervical cells change due to HPV effect.
Can HPV be transmitted even if you use protection?
Problem with HPV is a very, very small virus. It goes through the pores of the condoms. I'm not saying don't use condoms, you should use condoms, but in this case, in this particular case with HPV, condoms protect only in 65% of the cases. That's why HPV is so prevalent, that's why it's everywhere. And that is why we recommend to use HPV vaccine for younger girls to prevent cervical cancer. There's no treatment for HPV per se. There's no treatment for abnormal cells, slightly abnormal cells on the pap smear. The only thing that we rely on is your immune system. So you have to boost your immune system. So what immune system is boosted by? Vaccine. Vaccine makes your immune system to produce memory cells, sort of like a soldiers who will be prepared and ready in case if HPV, which is intruder, comes into the cervical surface. They know what to do, they know how to handle it. There are two major families of HPV. One big family has around approximately 45, 50 types of them in there, which we know, maybe there's more. So that family that creates cervical cancer, that's the family that we test when we perform pap smear. The second family, which also has around 30, 40 types of them, that family is responsible for genital warts. We call it condylomas. Condylomas do not cause cervical cancer, but they also are something that needs to be prevented because it's sexually transmitted disease. Genital warts are sexually transmitted disease. They transmit it through skin-to-skin contact, and most of the time, patients come with a lesion. They don't even know that they have it. Sometimes they could have a little bump, which there, sometimes it itches, sometimes it doesn't bother them. But in fact, if you have that bump, you're actually contagious. So you could spread it further to your partner. And then who knows, if you're not with this partner anymore, that partner will spread it to another partner. And that's how those candilomas spread. So the one that does cause cervical cancer is the one, that's silent one. That is the only one that we could see only on a pap smear. The only way to see it is to see it on a pap smear. The condyloma HPV is usually shows as in form of candyloma, so it's visible. So on the exam, your gynecologist will see it right away, and you will get the treatment.
Does the papillomavirus manifest itself the same way in males as in females?
It will manifest it the same way. It's a cauliflower-looking bump. If you really look under the microscope or magnifying glass, you will see that it does really look like candyloma. It looks like a cauliflower. But an HPV that causes cervical cancer, there's absolutely no symptoms. Unless if the lesion went too far and the patient already has cervical cancer, then manifestation will be bleeding, especially bleeding after intercourse. That is why it's very important to address that with your doctor. If you have bleeding, spotting after sex, it could be serious. It could be a sign of cervical cancer.
Consequences can have on females if they don't check on their symptoms.
The problem with cervical cancer is a lot of those girls don't pay more attention to those symptoms. They have HPV for years. They have that spotting for years. They don't go and see gynecologists. They don't get pap smears. And then 5, 6, 10 years later, they show up with a tumor, which is basically inoperable. And cervical cancer is one of the most preventable cancers.
Is there a possibility for adults younger than 30 to have the presence of HPV?
If you're younger than 30, we do not test for presence of HPV unless if there are some abnormal cells. If your pap is normal, we do not test for HPV. That is the recommendations. After 30, we test for presence of HPV and healthy-looking cells.
What are the new treatments in this age to prevent cervical cancer?
Until 2002, according to World Health Organization, the statistics showed that cervical cancer was #1 killer, GYN cancer killer in the world, and same #1 GYN killer in United States. After 2002, we started implementing Gardasil vaccine in our practices. We also started using ThinPrep, which is a new type of pap smears that we're using today. And newest statistics actually showed, that was around 2010, it showed that #1 killer became #9 in United States. And still #1 in the world because they did not use the same approach, which after all these numbers came up, Women's Health Organization and World Health Organization, they looked at the numbers and they said, we need to implement that, we need to use that. And now Gardasil is going further, and the techniques of ThinPrep and attention to HPV is drawn to HPV from other countries, and now we're paying more attention. And hopefully in 10 years, it's not going to be #1 cervical GYN killer in the world. It is not going to be #1 as it now in the world.
Are the controversies surrounding the HPV vaccine true?
I asked a lot of questions about vaccine and how safe it is. If you look at the vaccine, if you really want to judge the vaccine, if you want to see is it safe or not, you want to look at, first of all, as the most dangerous side effects of the vaccine. And we usually look at neurological sequelae, things like Guillain-Barré syndrome, very serious disorders that could have been created by vaccine. And if you look at numbers of Gardasil, how many cases of those were reported? There were 35 cases altogether out of 25 million doses that were distributed. So nobody can give you a 100% guarantee. It's not completely 100% safe, but if you look at the numbers, it's very, very safe. Another question people ask me, am I going to get HPV from the vaccine? Is it possible that I'm going to get actual HPV if I didn't have it from the vaccine? The answer is no. Why is that? When you get Gardasil, you do not get actual HPV. You get chemical formula, resemblance of virus, to fool your immune system, so your immune system would think that, oh my gosh, she has so much of those HPVs going on, and starts producing those antibodies, those memory cells, quick, we have a problem, and that's how you boost your immune system, and that's how you create that protective layer, protective wall against your HPV. Because the only way to get rid of HPV is it's your immune system. We don't have antibiotics, we don't have antiviral medication, we don't have anything. We just can help to prevent that from progression. If it gets to a certain point, we could stop there by doing leaf-gone biopsy, but that's all. The rest of the stuff, we rely on your immune system.